So back to Friday afternoon, 5 p.m. with the Digital Dental Society South Africa. And, this has really unfolded so nicely in the sense that we have this cocktail hour. It really is the culmination of our week. And I mean, what better way to end this than having a chat amongst, like, firstly, one of my favorite guys in dentistry, one of my closest friends in dentistry, one of my colleagues, and one of my mentors, Mark Bars. And today, I mean, we have Eugene Shumilov all the way from Russia. And, I think you guys are really going to find this conversation really interesting, because the more we start unpacking these digital workflows and the more we start talking about digital dentistry, we can see how that paradigm shift in our industry is culminating into something better, into something greater, and how our professions are invariably changing and unfolding. I mean, when I started practicing 17, 18 years ago, and when I think about the capabilities I had back then, and besides the experience and besides the workflows and everything that go into it, it's a very different profession that I'm in today. Our access to technology has just unfolded on a phenomenal rate, to the point that, I'm super passionate about the advances in dentistry. I'm super passionate about digital dentistry. But the way it's unfolded, it's almost difficult for us to keep abreast of things and for us to actually see how all of this is unpacking. So that, in essence, is the whole purpose behind these cocktail hour webinars once a week on a Friday. And, we slowly start unpacking all the different avenues in dentistry, and we start expressing and explaining exactly how these avenues all fit together towards what we have become today. And I want to just elaborate a little bit more on that. Historically, we were the doers. A patient came in, they saw us, we pretty much went into whatever procedure was required, whatever restorative procedure we executed, and the patient left. And that was pretty much how things unfolded. You look today, and I mean, with everything at our disposal, it's molded our profession from a doer to somewhat of an architect. And that's how I like to think about myself. That's how I like to think about the clinicians I work with, clinicians like Mark, clinicians like my colleagues at the practice, and many other clinicians around the globe. We've really become architects in the sense that we can take all our information today, we can digitize it, we can plan it, and from that planning, we see some incredible execution happening, which is a complete paradigm shift in our profession. So, I mean, as you all know, if you don't stop me, I can carry on talking. But without much ado, I'm going to introduce Eugene, and he's going to tell us a little bit about himself, and we're going to let this conversation unfold from there.
So, dear colleague, thank you very much for inviting me to this like a regular and very nice discussion. So, now I share with you my first slide of presentation. Please confirm that you all see it. Sam, do you see dentist workflow right now?
Yep.
Yeah. Okay. Great. So, but just I start from this background. To introduce myself, and you see here dentist workflow, but just first I would say I'm not a dentist. I'm medical doctor. I graduated medical school in late 90s, but just since beginning of 2000 I spent a lot of time in dentistry, and my main specialization in dentistry is to how to implement new technology in dental world. So, in early 2000 in my country, when I lived, I was one of the person who moved to the market light curing composite material. I think you remember the time when we use the amalgam, and then we use a chemical curing material to fill a patient tooth. But just right now, practically, I don't know, 99% of dentists you are using light curing composite, and again, like for country where I live at that time, like I spent a lot of effort, like to convert this market from the chemical curing composite to light curing composite. But just to be more for digital world, I remember like I would share with you like a story about myself. Since 2009, me together with my team at that time, I was a country leader of the Kyiv, Russia, and me together with my team, we start to develop market from the perspective of cone beam computer tomography. So in 2008 and 2009, I remember how it was like just a couple CBCT machine was across over huge territory. And we did a lot of effort to bring CBCT technology to the market. And I would say right now, every second clinic across over a huge territory as Russia is, every second clinic have got a computer tomography. This is a real digital revolution which has been done under my management and with my active participation. So there is a little bit historical aspect about myself, but again, I didn't put this slide about dentist workflow just to talk more about a digital and to talk more about how link offline and online together. So look at this slide. You know, this is a dentist workflow when we are working with a primary patient, and it is relevant across the globe. It's everywhere. In Cape Town, in San Francisco, in Moscow, in Tokyo, it's everywhere. So we are talking with a patient, and we have a look. We have a look oral cavity, what is inside, and then we accept to use X-ray. Of course, it depends on what we are doing. Sometimes we work just with a normal intraoral X-ray, usual intraoral X-ray, but the most contemporary way is just to use cone beam. And again, it doesn't matter. But the question is, then we use all this workflow, and then we use even cone beam machine to us. Agreement rate between two dentists is just only the 50%. What this stuff mean? That means if one patient come to two different dentists, agreement with them would be quite rare. It's amazing how offline, our traditional offline activity work with that. So
so Eugene, you're saying that in terms of CBCT diagnostics, there's conventional diagnostics, we moved on to CBCT diagnostics, and with CBCT diagnostics, we can see that there's a differential of about 50% when two clinicians look at the same scan. And that's pretty much where things unfold from.
I would express that it doesn't matter what kind of X-ray diagnostic tool are using dentist. Average dentist disagree with the average dentist. So no matter CBCT or a classical FMX. And the problem is not just technology, it's not a CBCT machine. The problem is inside of us. You know, we don't like to investigate. This is what we see across the globe. I mean, they prefer to find out something which we know how to treat. And then I'm conservative dentist. I'm immediately start to have a look some caries sign. But just if I'm implantologist, I have a look to the place where can I put implant, etc. First, again, we don't like to investigate. Second, we have a look, but we don't find out. And that is exactly what you asked me about, a CBCT machine and technique, how to read CT scan. And a lot of us, as I said, we have a computer tomography in our office. But the question, do we have well enough training to read CT scan? This is a big question mark. do we have enough experience to really read a CT scan? This is another question mark. And overall, again, like it looks like we are not just don't like investigate. We, sorry to say, we are not find out. You know, like a specific of the CT scan is a difference between CT scan and 2D pictures is that with 2D pictures, you start to make a diagnosis and to interpret it immediately when you have a picture. But with CT scan, first you should create those pictures. And the question is, do we have a well enough skill to create this picture? Do we have well enough skill to have a panoramic reformation for that? This is another big question. At last but not least, like a third problem, that, you know, we are, as a dentist, we don't like to feel ourselves as a salesperson. We are a service provider, but we don't like to feel ourselves as a salesperson. We prefer to share this passion only one problem and solve, and we prefer to solve it immediately. That is, I call like we don't convince passion to maximize treatment plan. We don't convince them to make a complex treatment. And this is again like a look at this 3 point. That is not about technology. That is about us, and we have to change it. But the question is how. So a little bit again like back to the history. So in this webinar, I represent a company called DiagnoCat, and DiagnoCat is a company which set up by dentists. Like we have our founder, his name is Alexanders. So like he has his own group practice. It's very huge dental chain, included roughly to say 500 employees. And like and he has a CT scan at every, he bought a CT scan for every his office. And what he saw that just one or two dentists from the one location, they really work with CT scan. And the rest, they continue to work with panoramic, or they continue to use a classical X-ray, like intraoral or biting. And like and Alex, 3 years ago, he invited two software engineers. So like those guys, they had experience with artificial intelligence. And he said them like, guys, so, you know, like I've got a CT scan in my office, but just a dentist for, I don't know for what kind of reason, they are still not use it. So utilization for CBCT machine was very slow at that time. And he said like, please help us to solve this issue. And that was initial reason to set up a DiagnoCat as a company, like to help dentists to read CBCT scan. That was a thirst. But but then we do more and more. So we recognize like these 3 points which you see right now in the screen. And you know, okay, at this screen, this is like a pain of every dentist across the globe. And like, who is suffering from that? Dentists suffer because of the dentist lose money. Like patients suffer because of he has not like a proper treatment. And that is what they convince. That is what they see how to solve it. Just we think, and our company would like to provide a solution as an assistant for any dentist to help to treat, to help to make a treatment plan, to start a diagnosis, starting from the pure and complete diagnostic, and then to complete treatment planning. And just an independent, totally independent expert as an artificial intelligence engine can help us. This is our assumption, and you know, like it was 3 years ago, and now we are with a big honor. Want to say like this is dental assistant tool. Now it's fully ready. And myself, I'm responsible for to talk with dentists about that, like to express them how to use it and why they have to use it. And that's why, again, like I really appreciate Sam and your colleagues like to invited me. So it seems like I thought a lot. So then now I should skip my presentation.
So Eugene, just to reiterate what you said, you know, with Alex, he had 3 years ago chain practice, 500 employees in the actual practice. The uptake on CBCT was slow, and that's when the whole development towards artificial intelligence started happening. So, in essence, the artificial intelligence is there to support and assist us from a diagnostic perspective.
Yeah,
if we look at the image that you've shown, it's as simple as uploading the digital image. The software, the cloud-based software, analyzes the CBCT in the background. And I know when I tested it out, I think we were getting a result back in 1.5 minutes. So in 1.5 minutes, we got a report out on a full CBCT. And I must say, you know, it took me another 35 or 40 minutes to go through the CBCT in detail, probably a little longer than that. And, you know, the findings were pretty impressive in terms of how that report was generated and how quickly it was generated. So before we, sorry, do you want to continue with the slide? Because I'm going to start asking a few questions.
No, just yeah, this is a round table. It's not like my presentation, and I really appreciate that you rephrase or like you emphasize something. One thing which I want to express that this is not a diagnostic, like you see, like a solution is a diagnostic support. Yeah, but that is detection. You know, like we have today, we have a lot of doctors who is with us. And I would say like only human, only doctor, only high-level educated and very well-educated professional can do diagnostic. Artificial intelligence as a technology, so like it can find out some signs of the pathology at the images. So like a technology which we use, it's called computer vision. Like engineers, they express it as a computer vision technology. And algorithm cannot diagnose this. Algorithm can detect, can say, look at this picture. Like it looks like a tooth number 48 is impacted. And again, like this is not a diagnosis, it's just a detection. And you know, like when we talk about diagnosis, we should express that we have a free stage to make a diagnosis. Like first we start from detection, then we are doing interpretation, and just when we are doing diagnosis. And for machine learning, there is not a way to reach a diagnosis because of the computer. They have access only for pictures. And
okay,
computer.
So I'm liking where this goes. Eugene, can I ask you to stop sharing your screen, because there's something I want to get into before you carry on with that. And the whole thing about artificial intelligence is pretty much the ability to diagnose. And if we unpack it back, we've got the ability to interpret. Firstly, the ability to detect, then the ability to interpret, and from the ability to interpret, then we make an informed diagnosis. Now, I want to backtrack that, and I want to talk about two different concepts, Eugene, and I want you to pretty much unpack that for us. We have, before we talk about artificial intelligence, let's talk about deep learning, and let's talk about machine learning, and how those come together to create the artificial intelligence that we're talking about.
Yeah, that is very good question. Like for all of us to understand what is the difference between machine learning and deep learning, and like is it really helpful to us, or like just something can be like with mistakes. So like machine learning is a technique which software people, they are using long time. So for example, when we see soccer game, you know, like we have video stream, like a soccer player, and then we see some, how to say, some supportive information, like a soccer number, and I don't like some penalty or whatever, like a goal, everything from this perspective. So like that is machine learning job, like to identify people at the video stream. And that is a very long technology which engineer knows. The difference between machine learning and deep learning is that you can educate algorithm to find out contour of a human at the live stream, and that is okay. Like a computer will find it very quickly, and then identify, like will express, like this picture you see, like a shape of the human, shape of the man. So deep learning are working like a more clever. So with the deep learning, you can educate and re-educate algorithm many times. With machine learning, you can do it only once. So like again, like with machine learning, there is a shape of the human. It's okay. An algorithm will express you every time when it will see at the screen like a shape of a human. It will express like this is shape of a human. But you know, like we can change our position, like we can change our clothes, we can change a lot, and for that purpose, we can use only deep machine learning. Because for deep machine learning, again, like you put more visuals, you put more information, you educate algorithm more, and algorithm became more clever. And specifically for images, machine learning as a deep machine learning as a technique start to develop something like 7 or 8 years ago, and we again, like everybody from us are using this deep machine learning stuff. When you use your smartphone, you know, like there is a face recognition algorithm. You can stay like this, you can stay like that, you can stay like this, but you know, like your smartphone every time will verify you as a you, and that's why that is because of the software people. They create the algorithm to identify your face. It doesn't matter what kind projection you looks like. But funny to say, when you put mask, algorithm cannot identify you. Like you can try it with your smartphone. Yeah, as soon as you put mask. Yeah, but you know, like why it happened? Okay, why algorithm right now not identify you with mask? Because of the software people, they are still not, you know, like the mask appearance from the mass market start 2 months ago due to pandemic time, and software people, they just not finish their job for deep machine learning to additionally educate algorithm how to identify human with mask. Believe me, like a couple months more, like we will have in our smartphone capability of our device just to investigate us, to have a look. You are the mask, okay, but like you are still Eugene Shumilov, or you are still Sam Thunder. I know, I am device. I know about you.
Exactly.
You try to hide the mask, but I know.
So if you take those concepts and you put it into dental radiography, for that matter, and we want to get involved in terms of diagnosing the image, you can see how machine learning would just pretty much identify just the tooth, whereas deep learning will go in and start identifying physiological changes within that tooth. And then from that, you start building the next layer of artificial intelligence, where something is actually taking that information and almost thinking for you.
Yeah, like your how to say, like a simplification is a little how to say, like a 90% correct. What I can tell you, like from the real algorithm, how real algorithm works. You know, when you upload your scan in the cloud to the system, like first system should recognize where tooth is and where just a background. That is number one. like what algorithm are doing. This is a tooth number, and then like as a second stage, algorithm after this tooth identification should say what kind number is it. This is a tooth number 18 or 17. An algorithm should express, you know, like it's quite difficult when you have bite wings, like how to investigate a tooth number, you know. And funny to say, Sam, there is no understanding at the software developer what kind way are using algorithm to understand that this is a tooth number X. There is no understanding. Yeah, you know, okay. Yeah,
it's amazing.
We educate algorithm by millions again, like annotated pictures, and after a couple hundreds, algorithms start to understand it. But this is again like this is not a this is not a diagnosis. It's just a detection. It's a way how algorithm recognize what kind of tooth number is in front of him. Like
so,
that is a that is the second stage, and just when algorithms start to detect signs of pathologies, condition, normal anatomy, and so on. But again, like algorithm are recognizing only thing which human educate him. So, like for example, like a restriction of diagnosis currently is that we are not able to detect a trauma or like a crack. We didn't educate algorithm about that. Mm-hmm. Like you have a question. Sorry, I interrupted.
No. Carry on. Mark?
Yeah, Mark.
No, so that, I think it's amazing now, to be honest, and only every day in my practice, I have to say that kind of human artificial intelligence, because we have an endodontist working with us, and we take CBCTs all the time. And his ability to read a CBCT from an endodontic point of view is at another level. So I don't even try to look at the CBCT like he does. And so now I can imagine having like 15 specialists in my room that are evaluating each different aspect of the CBCT, because we kind of see only what we want to see or what we're trained to see. But, you know, I will look at it and he'll come back with a report that would be completely different to my report, you know, from an endodontic point of view. So it shows that even after so many years, because I'm not doing it every day, I don't look for certain pathologies, or, you know, we're not trained to look for those. So to have someone doing this for you, like Andre, who works with me, would be amazing. Just the one question I have is it possible for the artificial intelligence to, obviously it can look at one CBC or one image and diagnose. Is it possible to look at different images from the same patient and compare those images from a time scale?
Yeah, like just a very, very, it's interesting question, which is coming not directly from the clinical perspective. You know, we have got a demand, I would say, from the perspective of forensic dentistry. Like we provide you picture of a, I don't know, like a tooth of a partial jaw or whatever. Like please investigate it, like, and compare with another CBCT scan or panoramic, and express us that this is fragment of this human. Yeah, like such demand we have, and like we are doing very, very like a big R&D, like to make it happen. And I wouldn't say that it's very easy, but just to answer for your question from a clinical perspective, good thing which we can do immediately. You have a 2 CT scan of the same patient, and you want to how to say, like 6 months ago, and I don't know, like now. And 6 months ago, you just observe this patient, and you see like a, I don't know, periapical lesion at the thumb tooth. And then like the problem is developing, but you still observe. But then patient come to you 6 months later, and you have a look and you see like a lesion became bigger, and now it's a time to treat. For doesn't matter what kind of reason. Like a good thing for you that you upload to the DiagnoCat these two different CT scan, and algorithm will find out for you like this tooth number. In your case, it's, I don't know, 16, and the algorithm will cut this tooth absolutely same time for CT, for these two CT. So that means you can compare by yourself picture versus picture.
Mm-hmm.
This is number one, what algorithm can do right now. Like a second thing, what algorithm can do. Algorithm can measure periapical lesion. I mean volumetrically measure, not just in millimeter, in cubic millimeter. And like if you have a 2 CT scan of the same patient, you can compare measurement measurement of a periapical lesion which you have 6 months ago and which you have right now. So that means you can have a clear objective understanding of dynamic. Like is it progressive, is it stable, or this is or you can see digression. That is what we have immediately. But just the answer, direct answer for your question is no. Currently, it's not possible to demonstrate you capability to compare two CT scan and asking algorithm is it the same patient or not. But again, like we are working to make it. It will come. Not sure that very fast, but it will come.
Okay.
But I think, Mark, that was your question, to actually compare one specific area.
Yeah, it was.
Yeah. And
it was to compare the same patient and the pathology of whether it's periodontal disease or endodontic disease or whatever pathology it is, whether this pathology is getting worse or it's stable or it's tracking on the same patient. So your answer was clear that you can do this already, which is great.
Yep.
That's amazing.
That's great.
You know, then you pretty much get your different cuts. You make your comparison independently, and then you get a volumetric measure of the actual lesion size, which is pretty amazing to do.
Yeah. No, that's hugely good. And the time frame is amazing. I mean, that 1 minute, I mean, you know, most of the criticism that I have is that, you know, in dentistry, we don't give ourselves enough time to make a diagnosis. You know, we go straight from the one stage to the treatment without giving the time. But now if we have someone else doing these steps for us, I think that it's going to make for sure for better treatment for our patients. No question.
Mark, you touch interesting topic from the time-consuming perspective. But I will increase more attention to another story. Like if then you are working with the endo patient. I mean, like with a patient which you want to make an endo treatment. You practically never ever can combine to stay at the operational field. I mean, I don't know, with microscope or with a binocular, and to see your CT scan. It's not possible. You know, like you should be in operational field or like without glove, like have a look at your CT scan. And like with DiagnoCat, you can combine. You know, like because of the DiagnoCat, prepare a picture for you, and this is a static picture. You can put this picture for display close from your at your treatment chair, because again, like you have a series of the horizontal slices, and you have slices cut it through canal. This is a so-called Understudy Report, and you can put it in front of you. So that means you are still in the operational field with glove. So you are still can have a look to microscope, and then like open your eye, up your eyes and have a look to the screen and understand like how X-ray situation from the 3D perspective looks like. And you know,
which is very helpful. Like often you find you clinically you're busy working, and then you'll take your mouse and then you're trying to get into the relevant cuts, or you're trying to look at it from a different view. I think to have it all in front of you offers a huge value, a huge advantage from a clinical perspective. So, sorry, Mark, is there something you wanted to add on to that?
No, that's fine.
So Eugene, this brings us to the next thing that I wanted to speak about, was the fact that, you know, we were chatting previously about the way dentistry has evolved, the way dentistry has changed, the way we have pretty much taken on a new title unknowingly. We're still dentists, but our ability and our access to information and our planning ability today, and the combination, the correlation of all of it put together, creates a completely different working environment for us. And one of the biggest things that we've seen, or that I have noticed personally, is that, or we've seen on a global platform, is that, you know, your dental practices have evolved from a dental practice that is just a pure service level thing to a dental practice today, which has got multiple layers on top of it. And one of the biggest things that come out of it is that, so two things I want to comment on. The first thing that comes out of it is that in today's day and age, the level of communication we have with our patients is far greater than 10, 15, 20, 25 years ago. And as time goes on, you know, patients at the end of the day demand a lot more information than they did 10 or 15 years ago, for that matter. The access to information is that much greater. You know, today you can go onto Google, or you can go onto wherever, and you can Google whatever you need to find out about. And what I'm saying is that the level or the type of patients that we are treating today are far more complex. They are far more socially aware. They are far more informed in terms of the treatments that they undergo. And I think in today's day and age, you know, communication is absolutely key. We need to have the ability to communicate with these patients. And I think looking at artificial intelligence, for example, looking at the asset AI brings into our clinical environment, suddenly we've got an added platform in terms of communicating with our patients. And I think that's critically important, because at the end of the day, to do anything ethically, we need to ensure that our patients make a fully informed decision in terms of whatever elective work they're going through. And I think, you know, as a dentist, it's very complex to diagnose and to read a CBCT. We need to simplify that. We need to unpack it. We need to put it in the most simple way possible for us to understand, as well as for our patients to understand. And I think, if anything, you know, incorporating these technologies into your working environment enhances and it aids with all of that. Say hello, boy. My VIP guest. Wait, hello. I'm gonna come now, okay?
Yeah, I think like we should ask Mark. You know, like Mark has got a long professional career. Please, Mark, can you tell us? Do we see difference between patient expectation, like 20 years ago, like, or 30 years ago, and now? Like, what kind of perception do you see?
I think for sure that when patients come to us today, they want the information, they want everything. They don't want to hear just a little bit of this, and they don't want to hear a little bit of that. I think where I see this really amazing is that, you know, also I think there's inherently some suspicion always if we tell patients something that's maybe worse than they think in their minds, you know. I mean, we all think that there's nothing wrong sometimes with these things, and then we say, oh, by the way, you know, do you see this on the x-ray? And it's coming from myself, and they trust me as a clinician because I have a lot of experience. But you know, maybe 20 years ago, I think that's really a challenge. You know, they start to imagine that maybe they need a second opinion because they don't trust that guy. But you know, if we have the computer who is not going to make a mistake on a diagnosis of a pathological problem for this patient. I think this is a great thing to be able to give the patient and say, this is not just my interpretation. This is not just, me today thinking that I see that maybe this is actually happening 100%. So yeah, I just think that it's a great communication tool that, maybe it's just another level of trust that we needed with our patients, that we have. So I think it's great, by the way.
So guys, so it sounds like we have a two direction. One direction is how we communicate, and another direction is how we convince. It's just only the two paths, but they're a little bit different. They are all together, but a little bit different. So how artificial intelligence can help in both directions. From the communication perspective, what algorithm can help us? A report which generated by algorithm is a much more easy thing for understanding than classical viewer, which are using when we are working with a CT scan. We have a movement picture technique when we evaluate our CT scan. This is our scrolling. This is how we set up an axis, plane, and whatever. And then we demonstrate it to our patient. For them, it looks like rocket science. As a patient, I really don't understand what you are scrolling here. You are super smart. You are unbelievable smart. But myself, as a patient, I really don't understand it. Yeah, and again, you use it from the communication perspective, and it's excellent to demonstrate that you are super clever. Period. It's world class. But the question is, we don't need to sell our patient that we are expert. They come to us and they believe that we are expert. The question is, we have to convince them for treatment planning. And from this perspective, our language, which we are speaking with our patient, should be as easy as possible. For example, Sam, boy, should understand what we express to him. And the question is, listen, Sam, how to convince your boy for treatment planning? If we will use a language which we are usually use, our professional language, like a periodontitis, like a caries, like a bone loss, whatever. We use our terminology, our professional terminology. But come on, most of our patients, even after education by Google, they still don't understand what this stuff means. And again, artificial intelligence provide you reporting, which have got a color codification, which is very easy to understand for any patient. Yeah, Sam, I believe that your boy, if you show him a diagnostic picture and you express this is red color, this is another red color, and red color is a problem place. He catch it immediately.
Let me tell you, my oldest daughter, I think when she was about five years old, she started designing on my CAD units. Because, it's a mouse, it's a trackpad, she can move it around. And it's amazing how they build that hand-eye coordination at that age. So it's the same thing with us. The more we get involved with technology, the better we get at it. The other thing I wanted to touch on, Eugene, was that I want you to just describe to our viewers. So I'm completely, let's assume I'm completely new to the whole field of incorporating artificial intelligence into my practice. I'll go back to my practice on Monday morning and I say, do you know what? I want to get involved with this. I think the things that I want to highlight here is that, and I always highlight this at every DDS webinar that we have, because of the combination of technology, we're at that point today where we can incorporate all these technologies into our working environment, and it doesn't cost us any investment cost in terms of the software.
True.
The investment pretty much on a pay-as-you-go basis. Am I right? So I want you just to briefly go through that with us, Eugene, in the sense that I'll go back to the practice on Monday. I want to get involved with AI. What are the processes? And from there, how quickly can we get on board?
So, like current digital world really help us to get access to something totally brand new by very quick way. You know, like we put our algorithm in the cloud, so that means everybody, every dentist can have access to the picture by any device which you use. Even your mobile phone, you can have access to your pictures. Yeah, like only one thing which you should have is any computer and internet connection. So, for usage of DiagnoCut, you should ask credentials. Like we start working through free trial. So that means you don't need to pay nothing investment. You need to invest your time, like to evaluate. So we need your email, we need your phone number, and we need your name. That's it. Like based on this information, together with our partner, this is a Smiled Quip in Pretoria company in South Africa. So like together with them, we generate account for you, and like you can access this account by normal browser, by usual browser as Google Chrome, for example. And then you have access, you come in, you have a look how it works, you upload your first scan, you upload your second scan, and it works. So this is as easy as impossible. You know, like we have a weekend in front of us, and everybody within such weekend can have his first uploading at his or her DiagnoCut account. Yeah. So
absolutely. So what we'll do, what I'm going to do, Eugene, you also on the WhatsApp group, later this evening or possibly tomorrow morning, I'm going to upload the link for DiagnoCut. So the dentists that are watching can go on there, can go on, get involved, upload their first case, test it out, and be amazed at how quick and how efficient this actually works. And once again, I mean, the beauty part is, you know, there's no financial investment. It's really just time. And the other part of it is that the more you use it, the better you actually get.
Yeah. Can I ask a question just quickly? So am I right in saying, and this is great because I don't know anything about this whole thing, and I'm so happy to be here right now. So you upload a CBCT, is that right? You upload the whole file.
You upload the whole file.
Mark, two things. Like you have absolutely good stuff. Like your you know, like your experience like generate us to be more precise. Maybe I didn't say it, but just I want to express. Currently, DiagnoCut is able to make a detection not just for CBCT, but for classical X-ray. That means full mouth series, and for panoramic also. So that means if you have a panoramic picture and you want to test it, you just upload panoramic and DiagnoCut will provide you detection. If you have a full mouth series, you upload, you have a detection on FMX. But just if you have a CT scan, you should upload full volume. That is like a range of the files. But just for somebody who has, I would say, like not 100% familiar with the file system, me together with Peter Prinsloo, like who is a leader for Smart Quip, we will help you to make this uploading, and then we will help you to educate your staff how to make this uploading inside of the DiagnoCut account. So that means for you as a dentist, the job will be just judge DiagnoCut detection. You will have a picture on your screen, and you will have a notice, like what algorithm find out. And as if you agree, you will mark like approve. If you disagree, you just click to cross, and like and this detection will disappear. That is how it works, like as easy as impossible.
Crazy.
Yeah,
that's amazing. Now, because my other question was, and I'm sure that you've done the research, is realistically when you take a CBCT, you know, what is the realistic time that it takes someone to go through it properly to make a diagnosis, rather than taking a CBCT and just looking for that one area that, because the responsibility is for us to look at it comprehensively. And so I think that for most times that CBCTs are taken, that really the patient doesn't get the full value that they're paying for, because, and I think we're all fairly guilty in not spending the necessary time really going through CBCTs properly. So, you know, I don't know what that time is, but I think to go through one properly must be something like 20 minutes, half an hour, I don't know, you know, but it's a long time. It's not very quick that you can really go through every cut and check for pathology for sure. And
Mark,
so we must miss a whole.
Mark, this is Friday, and there is not a joke. 2 minutes. 2 minutes. 2 minutes.
No, it's true. Yeah, but not for us to do it manually. It's going to take 20 minutes, 15 minutes.
You know what? I personally have to look at it at least 2 or 3 times. I look at it the first time.
Yeah.
I spend maybe 5 or 10 minutes. I then go when my patient is left, and this is the reality. After my patient is left, I sit, I go back in, I look through everything, and then once again at night. So I at least look at my CBCTs 2 or 3 times through different cuts, and checking everything out. And you know, when we played around with the system, which was just before lockdown, it was mind blowing, because we uploaded the CBCT, which was in the practice with us. We actually made a short video clip. We were going to release it shortly after, and then lockdown hit, so it never got out. But I mean, it was crazy quick, and suddenly, you know, all the detections were done. It was really just for us to go in and verify those detections, and there were. I mean, it was crazy. We uploaded a file which was multi. I mean, had complex restorative work done on it. You know, post and core, failing restoration, failing endos, implant evaluation, and I mean the detection was pretty incredible. So I think just from a timing perspective, Mark, you're 100% right. I mean, you know, at large, we don't offer, and at the end of the day, we're human, you know, and we don't offer the full diagnostic potential that those scans can give us because of time, because of our access and capability of diagnosing these scans, and because of the fact that there's such a dynamic range and how quickly the information changes around it. So, you know, if anything, it just adds that added value. I've got a comment that I just want to read out, and this is from Spiro, who's one of the members of the Digital Dental Society. And Spiro, I must say thank you very much. Every Friday I look forward to seeing you, and you're always with us. So his comment, he said, there are many situations where the interpretation of the X-ray or scan can be clarified when the AI confirms your finding and gives you the confidence to proceed with treatment quicker. Without AI, we would need to collaborate with specialists, and they are not always available when we need them. And that's exactly what we were talking about.
So, like Sam, as I arrange just especially for Mark and for anybody else, I can share my screen and demonstrate a real real analysis, real case.
Go for it. Go for it.
Okay.
Go for it.
So like I just share my screen. Like wait, have a look what we have here. Wait a second.
You'll see it at the bottom there, Eugene.
Just sorry, repeat again.
No, carry on. I said the share screen. It's right at the bottom.
There we go.
There you go.
I understand. Like sorry for my share screen. This is share screen application. There is it. Yeah, like before. Then I will prepare sharing. This is a little bit like this. share. Like you just share what I demonstrated, and right now, do you see like a black?
We got it.
Black screen. Yeah,
We got it.
Yeah, you. So like I just use first patient which I have. Like this is CBCT which has been uploaded, and that is report from CBCT. How we can generate like a click order button, and I choose radiological report, and you see like this this signal that I send request to the cloud to prepare a report for me to this case. But just as Mark has an interest from the endo perspective, Mark, I kindly ask you to make your choice. What kind of tooth you want to evaluate from an endo perspective?
For there, it looks definitely like you want to have a look at the 4.6.
4.6. Okay. I choose this one. 4.6. This one. And again, like I click order, and we send a request to prepare for us a report for tooth number 4.6. Like words reporting is again like a couple minutes, 1 or 2 minutes. And when we are waiting for the report preparation, I can show you the report which has been prepared just a couple hours before. Okay, I click here. So, and what you can see here, like first you have a panoramic reformation. Maybe I put it to whole screen for you. Like this is like a panoramic. This is not a panorama. This is artificial panorama, and it's done for us within 2 minutes. But that is only first stuff which we can have here. Sorry. Just click a little bit more than I need. So like a second thing, Mark, this is an interactive dental chart which informs us where problem is. As soon as you see red color and you remember like a same boy, like you can easily express him like, listen, this is problematic tooth, problematic, and so on. And then we want to evaluate one separate tooth. You just click to this tooth, like for example, 3.1, and then you click to all slices, and like then you see all visuals. Then you see all slices in front of you, like frontal view slices, then horizontal slices, then mesodistal slices, and then you see even more excited stuff. Like an algorithm mark you to pay your attention. Like, dear doctor, look, here is situation look like a periapical lesion. Be careful. Looks like periapical lesion, and that is we have immediately when we finish our reporting. So and
so just a question: Does the software pick up obviously images that maybe were taken in a faulty way or low quality images? I mean, obviously it's going to be able to pick up on the quality of the radiographic images.
That is very important assumption. So like if we put a bad quality image to the DiagnoCat, it continues to make a detection for us. But the quality of this detection will drop in accordance of the quality of picture. So
and will it tell you that?
Yeah. So that means if we have no, algorithm will not express you like a dear doctor, this is a bad quality picture. Yeah, this is like it's unpolite. This is algorithm. This is a machine, like not human. Algorithm can notify you, but not like change your stuff. So I have a look. Listen, our end report is ready. You remember you request like a tooth number 4.6. We click here and let's see what algorithm find out here. Like a first algorithm to make us an excellent panoramic reformation. Like that is number 1. Second, DiagnoCat provide you like a range of the actual slices started from a crown and come into periapical area. Then algorithm cut volume through canal. You see like how it looks like. Like this is a way how to demonstrate you like a root and canal system by most convenient way. Then algorithm cut volume through furcation. You know, like it's crucial before ender to check do we have a live furcation or not. And then mark, that is what we said, like algorithm mark periapical lesion and make a measurement. You see, like for this place, algorithm said like this is a 12 after 30, like a cubic centimeter. And for this place, you know, like this is, and this place, there is another periapical lesion, and this is a volume of this region. So, like as I said you before, you can put this picture mostly for display at the treatment unit when you're gonna treat this patient from the endo perspective. That is how.
Eugene, there's also the written report which I want you to show as well. The written report that actually comes together with that report.
Yeah, right. And you see, like our radiological report is ready, and based on this radiological report, now by couple clicks we prepare a report for patient demonstration. I click here. Like what we have.
This is the part I love. This is the part I love.
So, like you see some delay because again, like algorithm send us picture from the cloud. When to prepare this report, I click this print button, and then we have our report. You see, this is panoramic deformation. This is dental chart with a color. Then you see like a red color. That means this is a problem. And then we have a list of a tooth with the explanation what we find out inside. Tooth number 17, periodontal bone loss. Tooth number 16, etc., etc. We still can adjust it. Like for example, I don't need dental chart. I just skip it. Like a click, and there is not a dental chart anymore. Then I don't need slices. For example, for my written report, I click here. And here is, you see, just a list of tooth and findings. And
I love it.
That is, you can print it out, just a click, and within a couple seconds you have your report.
So you know, Eugene, Eugene, I'm like one of the laziest people you can find. I like doing what I want to do, but the things I don't want to do is primarily sitting and writing reports out. I mean, for this, you know, all I can say is I was definitely born at the right time for dentistry, because to be able to get this whole report in front of me, then you go in, you verify, you tweak little bits and pieces that you might feel you interpret a little bit better, but suddenly you've got a communication tool and you've got all your clinical notes in one place with the click of a button. It's unbelievable. It really is unbelievable.
Yeah, I fully agree with you, and I would express that such type of report help you not just only for medical records, not for your notes. That such type of report help you to communicate with your
communication.
Customer.
Communication. Exactly as we were saying, communication.
Yeah, like every separate person, every separate your patient can understand red color. They maybe not understand what does it mean periodontal bone loss, smile, but again, like they understand red color.
Absolutely.
This is, and you don't need to involve even dental assistant to prepare it, because of it's all in your hand. It's all in your hand immediately, just by couple click, and you see like I prepare it for you within just less than 2 minutes.
It's amazing. It's absolutely amazing. And you know, the first time I saw this in action, I was completely blown away. I'm even more blown away now, and I'll continue to be excited about it, because at the end of the day, it just makes what we're doing more tangible, and it actually as we were saying, it improves our level of communication within our team and with our patients. I mean, it's definitely where things are going, and I mean, to be able to do that report in such a short time period is really impressive.
Yeah, like, and we have a message from Facebook, like, please demonstrate us uploading, and please, Sam, continue to talk, and by at the screen I just show how uploading is. Yeah, just
no, go through it. You know, that's the whole thing, is that yeah, the technology is really impressive around this. Mark?
No, I must say that I was kind of had an open mind, and I wasn't sure what I was going to be feeling at what time was it, 6:10, but I'm super impressed. I have to say, you've made my week, Eugene. You know, we spend a lot of time on CBCTs in our practice, looking at them every day, and I have to say it's time consuming, and you know, for us that's one of the biggest problems, is we don't often have the time that we should have, really, to be spending on these sorts of this sort of thing. And so to have something that will help us, you know, I still think that as clinicians we still need, obviously, to make the final decision. You know, it's not something that we can just sit back and, you know, let computers make every clinical decision for us, but to make sure that we're not missing them, and to get to the point as quickly as this allows us is a game changer. You know, that it makes us look exactly where we need to be looking quickly, that we can make that decision, that we're not, you know, scrolling, and, you know, that's insane. That's what I really love.
It really is amazing. Really is amazing. So Mark, what we are going to do is, on our DDS WhatsApp group, we'll pretty much put the link. We'll get guys involved in terms of utilizing and using the free trial that's available to them. And after a few weeks, the plan is to actually get Eugene back again. And then we're going to start unpacking what the ability of the software is. And what we plan to do for that is we'll get one or two of the users on board with us to just describe their experiences. Because, I mean, technology like this it's available, it's cost effective, there's no investment cost, it's the time. But from my side of it, you know, to be able to create that clinical report in such a small time period, and for something to tell me where to look, it's definitely the way to go. So in about 3 or 4 weeks' time, we'll get Eugene back again, and we'll start unpacking the deeper aspects of the actual.
Just as one other question, sorry, is this really just dental orientated, or is it looking at sinuses, TMJs, like other pathology? I mean, is it kind of, you know, looking at the whole view that we take, or is it specifically looking for endo, perio, you know, these sorts of dental pathologies that we're kind of trained, but we need to look at the big picture as well?
Yeah. Like that is again like a deep understanding, like what clinician really need. So like I would express what we do to educate algorithm, and the rest we are not educate algorithm yet. Like we educate algorithm to find out periapical lesion, periodontal bone loss, caries decay, defect of the endo treatment, defect of the crown restoration, missing tooth, impaction. That's it. Okay. Yeah, okay. Like I would express like what we are not, what we still not finish. That is trauma, that is tumors, that is evaluation of sinuses, evaluation of a TMG. This is not done. And like from this perspective, Diagnocat is your assistant tool to evaluate something which you need as a dentist mostly. I mean, like that is cover your dentist need, but it's not cover of oral surgeon need, or like maxilla. So like I mean, like a surgeon who is working with a more wider option. Like you see, like we in our screen, we see we upload panoramic, and we have a report of panoramic. And just this is picture which come to us. Like what I can tell you, Mark, you are perfectly right that as a clinician, you spend a time to prepare, to evaluate picture. But just as, again, like as a clinician, you have a chance to miss something. And what diagnostics you provide, like you see, you can evaluate every separate tooth and like mark it. For example, this is tooth number 18, like a diagnostics show you, tooth number 18, and diagnostics said this is a sign of caries. And even diagnostics provide you demonstration where caries is. If you agree, you just click approve button, and that became approved. Like for example, next tooth, like a next tooth, again, like algorithm point us like a tooth number 17 and say like there's a voids in the root canal filling. From this perspective, tooth, so like algorithm think that this is a wrong endo treatment. But I'm as a doctor, I disagree. I just click this cross, and there is not a red color here anymore, and just I click approve button. So and then I will do it at every separate tooth. That means it protects you from the miss to the miss something. This is how it works.
Okay.
Yeah. So again, it seems
Pretty
like
cool.
we are longer than we have
All
to
good.
be.
Yeah.
Yeah. Sam, please manage us. We are 1 hour and 10 minutes more.
Listen, I'm enjoying the conversation. I'm just loving. I love the technology. I'm responding to some of the people that are actually been watching us, and you know, at the end of the day, like I said, Eugene, when we were talking the first time, you said, you know, English is not my first language, and you know, if I get stuck here and there, I mean, and what did I say? I said, look, at the end of the day, it's the cocktail hour. And the greatest value we get out of these conversations, you know, you go to like the DDS conference, for example, and you know what? All the value that actually comes out is actually at the end of the conference. And I'm not saying anything about, you know, the quality of the speakers, anything of that sort that happens through the day. But it's at the end of the conference that everyone sits down and they have a discussion, and that one-on-one interaction that they get out is where the penny drops, and where suddenly they think, you know what, if that guy can actually do it in his practice, or if that guy tells me that he's had some positive success with this specific material or with this specific scanner, I'm actually going to go and give it a shot tomorrow. And the whole idea about these webinars is to pretty much unpack it on that level. You know, like you and I have had previous conversations. You know, that was the beauty of it, is to actually get you here and get people to see your mindset in terms of how all this technology works, then pretty much showcase the technology in terms of what the technology can actually do for us. And from there, we start building that relationship. And it's all about unpacking the relationship at the end of the day. You know, it's about unpacking the actual software. And it's like any software, you know, you start using CEREC, for example, or you start using a specific digital X-ray platform or an RS device. It takes ongoing, consistent use of it to actually really understand the unit, really understand what you can and can't do with it. And after a certain time period, you have a lot of questions. So that's what I wanted to achieve today, and I think we've pretty much achieved what we wanted to. And in a few weeks' time, you know, we'll post the link on our WhatsApp group. You're on the group as well, and you know, I'm sure guys will ask you and interact with you and question you directly. And then in a few weeks again, we get you in another webinar, and by then, you know, there'll be a few users that we have in South Africa that have utilized the software, the cloud-based software, and from there we start unpacking what we can and what we can't do. And the whole thing is about, you know, gone are the days where, you know, products were created and there were big companies behind it and nobody really knew who to talk to, you know. I think those times are past. Or gone are the days, on the other hand, where we as clinicians literally stood there with our arms crossed and the patient came in and we asked them to sit in the chair and we executed treatment. I mean, that's the school that my parents came from, you know. And the sad truth is, you know, when I graduated from dental school, one of the first things I did was actually make my mom a full upper hybrid structure. Why? Because she went into the dentist, had all her teeth extracted. There were no questions asked. You did what you were told to do. And guess what? Here's the outcome. And I think those days are gone, you know. And I think like those days are gone, thankfully, and thankfully to all of us, and thankfully for all our patients, I think the days of dental companies creating these huge entities around them and providing these products out there, and at the end of the day, you have nobody to talk to, you have nobody to interact with. There's various different layers in that organization, and you know, invariably what happens with those things is you tend to actually take those products and customize your clinical practice and your way of practicing to suit the product. It should be the other way around. So once again, I mean, I think we've pretty much unpacked what we wanted to today. Mark, I mean, do you have any ending notes before we call it for this evening?
Listen, I just want to say, I want to say anything that makes me look smarter and makes me work quicker, I'm happy with. So I have to say that, yeah, that was pretty impressive. It was really impressive, I must be honest. You know, I haven't had any access to any of the artificial intelligence radiography and the other things that are obviously available. But we're definitely going to give it a whirl, and we'll definitely get back to you on that one. Because you know, we invest a lot of money on our on our equipment, you know, like CBCTs, but I think that we can all put our hands up and say that we don't get the best out of them, you know, because of all the other factors, you know, that we don't see or we don't have time. And so if we have something that sees and does it for us and has the time for us, like, you know, it's a win-win.
Absolutely. Mark, just one last question. Where are you in the world today? Because I don't recognize it.
Where am I in the world?
Yeah.
I'm sitting in like cyberspace, man. Let me tell you, looking down. And I didn't pick anywhere in the world today.
I was waiting for a picture on Russia, but Mary says she thinks that you're in the Matrix, and it pretty much looks like
Matrix. Yeah. Got a rough week. I'll tell you about it. But anyway, we've come out the other side.
Absolutely. Eugene, thank you so much. We appreciate your time. And
thank you.
Mark, once again, always a pleasure to have you.
So Sam, one statement from my side. Like we start this discussion about AI and diagnostic, but I want to finish that the biggest heritage which all of us has is our patient and trust between us and our patient. And the thing which AI can help you just to create a trust between us and patient. That is exactly like the biggest value which we can have. Like all our speeches, diagnoses, and so on. This is like just a stage, which again like to summarize as a trust to us from the patient. That is the mission of Diagnocat as a company is to make dentistry error-free. And this is like everybody can participate in this part. Like thank you very much. Thank you very much for your attention.
Thank you
for all your questions and for your patience. Like we demonstrate today a lot.
One thing I want to end off, Eugene, is that as you say, the only thing we have in this world today is our credibility, and without our credibility, we have nothing. So anything that helps us to build our credibility and reinforce it and reassures it is always welcome. Enjoy your weekend, and we'll see you. Mark, I think we've got another one on Tuesday with Ralph George from DSD.
Yes. We're going to do it next Friday.
Is it next Friday? Next Friday. Yeah. Perfect.
Also,
we'll see you guys next Friday.
AI.
Absolutely. Another AI version, and we'll take it from there. Enjoy your weekend, and we'll catch you guys soon.
Happy weekend
Bye-bye.
for everybody. Thank you, Gens.
Yeah.
Bye-bye.
Bye.